Is it possible to be too old or too young for knee replacement? Stick around to find out. Hello and welcome back. I'm Adam Rosen. Thanks again for tuning in. If you haven't already subscribed, please take a minute to do so and click the thumbs up button if you enjoy this content. It really does help people like you find this information. So, in today's video, I'm going to talk about really two groups of people. Can you be too young for knee replacement? Or can you be too old for knee replacement? And the answer basically is no, but it depends. Depends on the indications for surgery. So if we first talk about the young patient, we're talking about 50 and under, even 55 and under. And can you be too young? Now, years ago, people always would say, wait until you're older because implants weren't so good. But implants nowadays at 20 years, 90% success rate. So if someone's in severe pain, has a decreased quality of life, there may very well be an indication for surgery. Now, at certain institutions or with certain insurance companies, you might get flagged and there might be a series of questions or phone calls or appeals to get it approved, but the indication for surgery might still be there. But we have to choose the right patient and we have to educate the patient. So very often young patients tend to be dissatisfied if they have unrealistic expectations of what a knee replacement is. Because again, I've talked about this before, a knee replacement is much better than a bad arthritic painful knee, but it's not a normal knee. So if you're 48 and you have arthritis and you expect to get back this 30-year-old knee, you're probably not going to be happy because the implant that we put in most young people is the exact same implant that we put in older patients. There's not a young knee replacement and an old knee replacement. The other thing is we want to make sure that your arthritis is severe enough to warrant knee replacement surgery. There are plenty of studies that show that if you have more than 2 millimeters of joint space remaining on your x-ray, those patients tend to have poorer outcomes, no matter how old they are. But we see this in the young patient where someone has knee pain, has a scope, has a series of injections, goes to therapy, and you see enough doctors and complain about pain and they kind of check off the box of everything else that can possibly be done for you has been done, and someone's going to offer you a knee replacement. And that might not always be the best option. What I always try to explain to my patients is that I'm not saying that you don't have arthritis and that you don't have pain. I'm just saying that sometimes your pain and arthritis is not severe enough that will allow you to see the benefits after a successful knee replacement surgery. And we don't want to do a surgery where we hear from patients afterwards that their knee now is worse than it was before surgery. The other thing is that some young patients describe this sense of instability because they lose what's called proprioception. When we remove the cartilage and commonly the anterior cruciate ligament and the meniscus, you lose some of this feeling of where your knee is in space. So even though the collateral ligaments may be stable in the knee replacement, because people don't feel like it feels like a normal knee, a lot of young patients that are highly active have this sense that the knee feels unstable to them. And that can lead to an unhappy patient or a less than successful outcome in the eyes of the patient. And this has been studied with what we call patient-reported outcome measure scores, that more frequently patients that are younger tend to not report improvements in pain as much as patients that are older. The other thing that we have to worry about in young patients is that, yes, at 20 years, 90% of knee replacements are still successful. But if you're 50 and you live to 90, there's a good chance that you may need a revision. The other thing that we run into with young patients, because they're so active, is sometimes loosening of the implant, a debonding of the implant from the bone or from the cement that is used to adhere the implants to the bone. And the last thing that young patients tend to struggle with more frequently than older patients is stiffness. Why this is, I'm not sure anybody really knows. There may be more of an inflammatory response. Maybe there was more of an inflammatory arthritis, which is what led to the need for knee replacement in the first place. But normal knee replacements around the world get about 115 to 120. So again, if you expect 140 degrees of bend and you get 115, that's still pretty average. But for a young patient that expects 140, if they weren't educated on the normal expectations after surgery, that might lead to an unhappy patient. Now, there's been lots of studies that have looked at the evidence for knee replacements in young patients. And again, it's discussed all of the things that I just discussed with you. There are still a number of studies, again, that report that there are a high level of residual symptoms in young patients that undergo knee replacement. And some of you might have the question, but what about some of these newer designs that are press fit, where we're not using cement, we're using a porous implant that grows into the bone? The idea there being that there's biologic fixation, so it should result in a better outcome. But studies have shown that there's really no difference currently seen in press fit versus cemented implants in younger patients. And one of the last things I wanted to bring up, specifically with regards to younger patients, is the idea of certain implants or coatings or designs. So Smith and Nephew has an implant called oxinium, and the idea is that it has better wear on the plastic than straightforward cobalt chrome. And this study that did win an award didn't show that there was any difference in patients that received a cobalt chrome versus an oxinium implant with regards to pain, wear, or survivorship of the implant. Now, on the other side of the coin, what about older patients? And can you be too old for a total knee replacement? And the answer is not really, but again, it depends. The oldest patient that I ever did a knee replacement on was 97. And you're thinking, seriously? But yes, she was 97. She lived alone. Her only medication was aspirin. And I followed her for years. And I was giving her cortisone injections. I watched her go from walking to the use of a cane and then to the use of a walker. And she was heading towards a wheelchair because of the severe arthritis and deformity that she had developed. And she told me point blank that she didn't want to live in a wheelchair. For her, it was not a quality of life. She was willing to accept the risks of surgery. And at that point in time, I actually happened to have a bunch of 90-year-olds on my operating room schedule week after week after week. And I wasn't really sure if this was a good idea. So we did a study, and many other groups have done similar studies and looked at the 90 plus patient nonagenarians and whether or not those patients actually are safe to operate on. And what we found, along with many, many other studies, is that patients that are over 90 tend to have a higher risk of medical complications. So these would be things like stroke or heart attack, pneumonia, urinary tract infection, ileus, even things such as death, pulmonary embolus, blood clots. All of those medical complications are higher. In our particular study, we broke it down by decade, and we looked at patients between 70 and 79, 80 and 89, and 90 and above. And what we found is that orthopedically, they all did the same. But if you're between 70 and 89, your risk of medical complications was significantly lower than those patients that are over 90. And again, this is a biased cohort, meaning a group of people that is biased because we weren't taking all comers. Because if you're 90 and sick and you're coming to the orthopedic surgeon, you're probably not even thinking that surgery is an option. And as a surgeon looking at a patient who's over 90, I'm not even offering surgery if I think that you're too old or too sick to undergo the rigors of anesthesia and surgery. So the 90-year-olds that we are operating on are really the healthiest and the safest 90-year-olds to operate on. They're also patients that have the most severe arthritis or disease for us to even discuss the idea of undergoing an operation. So when you look at these numbers, you're not taking all 90-year-olds, you're taking healthy 90-year-olds. But what's also interesting is when we did our study, when you look at the United States and Medicare data, if you are 90 and above, you have 3 times greater risk of being hospitalized for any reason. So although in our group, 90 and above had a greater risk of medical complications than 70 to 89, that 3 times greater risk was pretty equivalent to the population at large. So when it comes down to whether or not you should have surgery, really the important thing is, do you have severe arthritis? Do you have severe pain? Do you have decreases in your quality of life? And especially if you're young, is that decrease in quality of life within reason for improvement after knee replacement surgery? You know, if your decreased quality of life is you used to run marathons and now you're only running half marathons, probably not the best person to have a knee replacement. But if you can't do regular activities like with your family, coach your kids' baseball team, take a walk with your spouse, have trouble going on vacation where you're going to do a lot of steps, maybe going to Europe, those are improvements that we can make better after knee replacement surgery. But each group has its risks. So if you're too young, you want to make sure that you have tried all the conservative care measures prior to considering knee replacement surgery, and make sure that you're educated on what to expect after surgery. If you're older, make sure again that you have significant limitations in your quality of life and discussions with your primary to make sure that, health wise, that you're as healthy as possible and as optimized as possible before you choose to go through elective surgery, such as knee replacement. Well, I hope this information has helped at least answer some of the questions that you might have if you're too young or too old and considering knee replacement. Until next time, stay safe. I'm Adam Rosen, and thanks again for watching.